It's time for Nip Talk.
I think that one of the things that I can help people out with is being a plastic surgeon. I can give people the secrets and the tips that can prevent them from having a botched experience.
Well, I will tell you, a really good girlfriend of mine, I'm gonna not say her name because I'm embarrassed for her. So she was like, hey, I'm like kind of broke right now, but I still want to get my Botox. And that's my first rule of thumb. I don't care we will negate everything else in our lives before you do anything that cuts corners when it comes to your face or your body. That's just
I wholeheartedly agree.
That's just my thing, right?
Absolutely.
You can cut anywhere else. And so she's like, well, my foot doctor, I know, this is
Wait, what?
My foot doctor got a license or whatever it is that you get, like a certification to be able to, do injections. She's like, oh, he did my Botox for a lot cheaper. This girl went to a foot doctor to get her face worked on. That's a real thing. You would not go to a heart surgeon to have something done with your stomach. And I told her, I was like, are you nuts? So let me get this straight. You saved $100.
So I have to ask, how did it turn out?
Terrible. Half her face, she looked like Two-Face from the Batman movie.
She looked like she had a stroke?
Yes.
Yeah.
She looked like Two-Face. Like, you know how Two-Face has the literal two faces? It looked like half of her face was Bell's palsy. It was terrible. Man. And so I was like,
there's nothing you can do about that.
There's nothing. You've got to write it out. And so then she didn't listen to me then. Same person went and did her lips, doc.
Wait, the foot doctor did her lips?
Foot doctor did her lips. Wow. Because homegirl was still trying to save money.
To be honest, though, I kind of am impressed that somewhere out there that there's a foot doctor that's like, you know what, I'm just going to start injecting people's lips because feet is so much like that.
It's guys, why? So then, of course, her lips got insane, insane. It looked like she fell face first into like a beehive. It was so bad. It was mortifying. So then, and I don't know if y'all know, you obviously do, but y'all watching, the process of having to take filler out of your lips
it's the worst. Don't do it.
Worst.
It's better just to let it wear off.
Terrible. But they were so bad.
Really?
They were so bad. They were so bad. She looked like a Muppet. It was so bad.
It's funny you mention that because that is going to be one of the things I have. But probably to me, one of the most important things that patients need to know if they're considering plastic surgery is avoiding medical tourism. I'll tell you, I still take call at a lot of hospitals for emergency, and probably once a month I get a call for somebody that's having a pretty severe complication from having plastic surgery out in a third world country. That is a thing. I mean, it's hard to me.
Well,
it's hard for me to
Kanye's mom died doing that, right?
Oh, is she out of the country?
I think it was out of the country. Don't quote me, but I'm sure Kelly knows this. Kelly's our pop culture.
Kelly. Kanye's mom.
Yes, you're absolutely right.
Thank you.
Medical tourism. Wow.
Yes,
okay.
she went out of the. And you're Kanye. You've got money,
you got
bro.
so much money.
How do you not do it here? I know. So that's how she she passed away, and that's sad. But she passed away from her complications.
Yeah, that's terrible. Well, and I'm a plastic surgeon who is very kind of cognizant about the darker side of my specialty because there are things that are not great about it. And so, I worry sometimes about people getting plastic surgery in the United States. Going to a third world country, to me, is just like playing Russian roulette. I can't express to people, please don't do that. I see so many patients
cut corners with your electric bill, not your face and your body.
But kind of going back to what you were talking about would be the next thing is if you are going to have plastic surgery, and I know that injectables is not surgery, but if you're thinking about having plastic surgery, one of the most important things you can do is to make sure that your surgeon is board certified by only the American Board of Plastic Surgery. And we're going to do a show about this, but there are fake boards out there that people get and they pass themselves off as plastic. I could go on for an hour about that, but I don't want to ruin the surprise.
Wait, there's fake boards?
Yes, I'm not kidding. I'm going to teach you all about it. That's the reason for you guys to tune in.
Okay.
Yeah. So, and then I think that the next thing to do to avoid a botched experience is when you go do your consults, you need to ask the hard questions. I get a lot of people that come in and they're just almost kind of docile and, they don't really ask a lot. And I feel like I could just walk in and say, okay, you're having a tummy tuck tomorrow, let's go. And that's not the way I do things. I really feel that informing patients is the most critical thing.
Okay, so do you get, and I'm the same way, I'm an asker. It's just by nature.
I love when people...
because I'm just annoying. I ask questions. Yeah. But then, and I feel like people who are in that consultation chair are like, well, then is the expert going to feel like I'm discrediting he or her by
I think that there are some doctors that probably would think like that, but that should be like a warning sign.
Like it's probably, aren't you more excited like, oh, this candidate's asking questions?
Dude, I love that because then that means they've at least put some research into it, and they're, in my opinion, they're more likely going to have an outcome that they expect and they're happy with.
Right.
You know, and I'm sure there's a lot of people who don't do any research. They have plastic surgery and it goes fine. But
they feel like, oh, he's the expert. Like I trust him, right?
But no, I love when people ask questions. And in fact, like if somebody can ask a question, I'm like, wow, I'll even think that's a great question. You did your research.
Oh, so you said that about me, so I feel like you say that to everybody. That wasn't.
I did say that?
Yeah, you did.
Oh my gosh. Well, see, that's great. So some of the things that I think that you should ask if you're talking to a plastic surgeon is, what does the surgeon think that your expected outcome is, and does that outcome match what's in your head? Because one of the biggest ways that people are unhappy with plastic surgery is the surgeons think it's going to be one thing and the patient thinks another. So asking about those outcomes is very important. Also, where's the surgery going to be performed? You know, that plays a lot into
hospital or someone's garage.
Right. You know, and I hate to say that if people do surgery in the office that it's a warning sign. It can be because going back to the fake plastic surgeons, they can't get privileges.
Can I share a
surgeries.
story?
Please.
Like these people, okay, locally here in Dallas, this was a couple of years ago, and I read this story and it was so nuts. And this woman was doing butt injections.
Oh my God, I know about that.
Out of her garage.
Yeah, it's not just here. But
it's everywhere.
Yeah.
There's so much. I know there's so much to unpack with that sentence. But butt injections in her garage, and she was using not injectable saline, like medical saline. Yeah. It was basically
from Home Depot.
It was like cement sticks from Home Depot or something just dumb. Like my first reaction is, folks, when you pull up and the address shows a garage.
Yeah.
At that point, you still go through with it. Like how many red flags.
It's funny you mentioned that. For the longest time, there was a sign somewhere here in Dallas, and my wife and I saw it when we were driving down the road. And it basically was like on a bridge, and it had a sign that said plastic surgery, and it had an arrow, and it literally looked like it was pointing under the bridge. And I assumed that there was probably an office under there, but I don't know. We always joke that there was some homeless person under there doing plastic surgery.
Or just something. I mean, listen, I'm all about someone making $1, but don't be saying you're a surgeon when you're not.
A couple other secrets when you're in the consult. I think it's very important to ask, is anyone else going to be doing the surgery? That's a very kind of unknown thing in plastic surgery, is a lot of surgeons will hire people to either do part of the surgery or the closures, and they won't necessarily mention that. Now, I'm a control freak. When I'm big time. When I'm in surgery, I don't even let them cut my suture. People laugh because I'm known for doing that. Usually most surgeons, if you tie a knot, you let the scrub cut the suture for you. But I'd like to do it myself because I want it to be perfect. If it's too long,
no offense, I'd rather you be a control freak than go, nah, it's fine.
It's good. Just roll
it's fine.
Yeah. Other things, asking the surgeon how many of those surgeries they've done. Plastic surgery is very broad, and so for me, I focus in breast and body, and so when people come in and say, oh yeah, I've done thousands of these, but if somebody comes in and was asking for rhinoplasty, which I just really won't even take consults for anymore, I'd say, yeah, I've done 1 or 2, so really you don't want me doing that. But there are surgeons out there who maybe they're not busy and they would be willing to give it a whirl. So I think asking the surgeon how many of those particular surgeries they've done is important.
So question for you, and maybe this might be kind of going off script here, but bringing that up. So when you're when you go to plastic surgery school or whatever, call it university, right? Not school.
Fellowship.
It's not some school off the highway.
Fellowship or residency.
Right, exactly.
Yep.
So are you taught are you specializing in necessarily for example, if you're okay, I'm just going to do breast or something else versus how is it that some plastic surgeons are we only do rhinoplasty, we don't do that. So how are you taught everything?
Yeah. So basically to graduate from that program, you do have to get a certain number of cases in each category. And so you have to get a certain number of breast cases, abdomen cases, facial cases. So some people go to programs where they're really heavy one thing or the other, and they just feel more comfortable with that. And they may go out and say, oh, well, I'm going to be a facial specialist because at my program we did, 2,000 face cases and we did just the bare minimum of everything else. So that's one way. But the other way is people do what I did, which is after plastic surgery, they'll go and do a fellowship.
So is there a procedure that you favor? What's your favorite to do?
I like the breast probably is my favorite. It's very artistic.
Yeah.
So that's probably my favorite stuff.
Thank you.
Yeah.
Thank you for fixing this.
So a couple other things, checking their befores and afters is very important. You can usually find somebody that looks like yourself and see what the outcome would be. Also, checking reviews is huge. I think Google reviews is probably one of the best ways to check and see, how good a surgeon is. Be wary if they have like 2 reviews or if they have something that's really low.
Yeah.
And then lastly, I think not doing too many surgeries at once is a good way to avoid a botched experience. Your surgeon should stop you from doing that, but some surgeons want to, get a lot of money. So like, yeah, we can do facelift, tummy tuck, breast, arm lift all at once, which is just a bad idea.
So what's the longest? Okay, I have to pause you here. So
Yeah,
what's
sure.
what's the longest surgery day you've ever had? Like, is it okay to do multiple
It
procedures back
is.
to back?
I limit stuff to 2. Now, since I do everything myself, like if I do a full mommy makeover, you're talking like 7 hours of surgery. Yeah.
How do you,
But
okay,
that's fine. Anesthesia's safe. That's like fine. Really, it's more about doing multiple procedures, like not the time of anesthesia, but the number of procedures at once is a little bit more dangerous.
how do you prepare for that?
I mean, I was trained to do that stuff. Yeah.
That freaks me out. Like, I would have major anxiety the night before of a surgery.
Yeah.
Like, what if I'm not going to have a drink.
Yeah.
I'm not going to stay up too late. Like, I'm just,
Just like your job, it becomes routine, truly. I mean, sometimes you do hard stuff in your practice, but anyway, those are some of the things that you can do to avoid a botched experience. Also, I do encourage people to get multiple consults. I like it when people do that.
Yeah.
So,
Well, because then they do their homework.
Yeah.
And then they know to go with the best.
so